Thank you for that introduction, and good morning, everyone. It's my honor and privilege to be here today with you and speaking about sustainability and its intersection with healthcare. Given that most of you don't know me, as a way of introduction, I wanted to put a few slides together to tell you a little bit about myself. And somehow that turned into an interesting self-discovery moment for me that I think actually plays well to the talk. So I hope you indulge me for the next few slides. But basically, my family and I moved to US and LA area in 1996 from Iran. And nearly 30 years later, we all still live basically within the same 1 or 2 square miles. And then when high school ended, I joined USC. And again, many, many years later, I'm still here at USC. I joined right around the time SC hired Pete Carroll and during the George Bush heyday era, and all of them left, and I am still working. And I think you can see a little bit of a trend here, but when medical school started, I got my first new car, which was a Prius. And to the disappointment of my chair, who worries every day whether I'll make it to work or not, 320-something thousand miles later, I still drive this thing and love it. And with that, I started to become involved with sustainability, and my first initiative was in 2020 and getting rid of desflurane and not really planning on going anywhere anytime soon. I don't have anything to disclose financially, but I do have a disclaimer. I've given a good amount of sustainability talks over the last couple of years, but most of these are formatted in a way, that you do healthcare sustainability one-on-one lectures, to audience that may not really have any prior awareness. And what I really wanted to do or did not want to do is regurgitate the same material here. So about a month or so ago, I'd reached out to Dr. Kalra to get a little bit of an insight into your department and your group. And I got the good news and I got the bad news. The good news was that there is a very high sense of, knowledge and awareness about healthcare sustainability in your department, in part thanks to all the work that's been done. The bad news for me was that I could not recycle the same lecture and needed something new, which was a really interesting challenge for me because I've never given a sustainability talk to a group that already knows about sustainability. And that sent me on a pretty interesting journey, and I was actually surprised at the end by the presentation that I came up with, and I hope you enjoy it. Most times, if your talks are similar to our ground rounds, you have an expert coming in and talking about, the latest and the greatest or the most innovative way of doing something. And this really isn't that type of a talk. I do have a central question that I'm asking and do my best to try to come up with answers for it. I don't think anyone really has answers to it. And what I learned a little bit earlier before starting this talk today is that you're a group that's pretty engaging at the end of presentation. So I would love for your feedback and your thoughts and suggestions as to, how we push sustainability forward. Objectives are pretty straightforward. We're going to review the challenges associated with achieving carbon neutrality and evaluating approaches to addressing these concerns. And most of my talk, probably 80% of it, is going to be focused on these two. But at the end, we'll do a little bit of a shift and do some compare and contrast of various sustainability initiatives at USC and maybe some that's been done here at Stanford. Because I'm not going to do much of an intro to sustainability for you, what I wanted to do was just tell you about the 3 key assumptions I'm making. Now, you may not 100% agree with these, or you may agree to different levels, but I think it's important to know that, where I'm starting from. So the first assumption is that climate change is an existential threat to all of us. And I think for me, the best way of looking at this in a country like US that's has a lot of data and it's politically much more stable than most other countries is following the money. So just as one example, what I wanted to do was look at, weather disasters costing more than $1 billion in damages. And these numbers are all inflation adjusted. And when you go back, in the 80s, every year on average, there was about 3, in the 90s, 5, and you can see the trend of it continuing. 2014 so far, basically as of July 9th, which was the most recent data, we were already at 15. And if you see the graph to your right, you'll see that most of these disasters actually happen in the second half. So we're probably well on our way of breaking that record. And it's one thing to just look at these and go, okay, that's a pretty terrible thing, and those are just numbers. But in reality, every time you have these, it's lost lives, it's lost businesses. So it's pretty impactful. The next assumption is time is running out. This is a part that's a little bit tricky because, we don't necessarily know what that time frame is and how the changes will look. And we know there's a lot of positive feedback loop and in a negative way when it comes to the temperature rise and changes that are happening. And, we have pretty accurate temperature measurements going back to the 1880s. And that slope is continuing to climb up and has not bended yet. And the last assumption, and this was surprising for me, to be honest with you, given the rhetoric that we constantly hear, but that is, as a society, we actually believe that climate change is real and these changes are happening and they're impacting us. And I looked at a lot of different polls that surveys had done, and I decided to pick one from the Pew Research Center. And I like this because of the question. The question basically was asking the US adults whether they think climate change is affecting their local community. That means change happening today, not change going to happen in the future. And 61% of US adults felt that their life is being impacted. Their communities are being impacted. Now, obviously there is some differences based on political background or the region you live in, but as a whole, we do think that this is a real problem. And just wanting to put things in a little bit of a perspective for you, I looked at some of the other issues that may be more controversial within our political climate and just see where people stand on this in terms of the percentages, so you have something to compare. So 63% believe we need to have coverage for all, 63% believe abortion should be legal in all or most states, 59% support immigration and that they think immigration makes the country stronger, and 58% favor stricter gun laws. So the 61% is sort of right in the middle of that. So the question that I really wanted to ask, and this is sort of the meat of the presentation, is why is nothing happening? And you may push back and go, there's a lot that's happened over the last few years, even maybe in your own personal life, driving an electric car, or having solar panels, or you recycle and you compost and etc. But the reality is this is not really about an individual or the local microenvironment. This is much bigger than that. And when you look at big scale, not much is happening. So just as a brief example, wanted to take a look at 1994. Ace of Base was top of the music charts. Lion King was killing it at the box office, and that ugly car over there was the best-selling car in the country. And at that time, 80% of our energy was coming from fossil fuels. And then you fast forward 30 years later, where you got all this talk and conversations about solar panels and wind energy and electric cars, and guess what? 80% of the energy still comes from fossil fuels. And interestingly, that percentage really has not changed much since the 1900s. And so, yes, we are using more renewable, but we're also continuing to use more fossil fuels. And what's really fascinating about this is the fact that, excuse me, sorry, GDP in 1994 was around 9 trillion, and in 2024, it's 3 times as much. So it's a lot more fossil fuels that we are burning. So back to the question, why is nothing happening? I'm wanting to focus it a little bit more on healthcare. I'm going to give a little bit of examples, from myself. We know that we work in a very complex health system. Healthcare itself is pretty complicated, and you got all these stakeholders, bureaucracy, opposing views, competing priorities, the expense, and then, by the way, let's not forget that we're here to take care of patients. And the challenge is this. So, and you're going to see examples of this at the end of the presentation where, I'll show you this wonderful initiative that we've done and successful and celebrating it and everything that kind of goes along with that, great, wonderful story. But the reality is this is really how it feels to get to that, even for the most minor of projects that we work on. It ends up being months of meetings and conversations and getting buy-in. And sometimes you do all that, and then at the end, you still end up hitting that brick wall and have to restart. And we really can't bend that temperature curve if this is our approach to sustainability. So in the next probably 15 slides or so, I'm going to give you, at least my best attempt at answering that. And it's really difficult to cite sources if for a topic like this. So instead, what I decided to do is just put a few of the books and resources that I used in putting together my version of an answer for this. And what I really wanted to do was to see if there are examples within healthcare where we had drastic changes and we were able to change the way we practice medicine very quickly and effectively. And if there's anything that we can learn from that when it comes to sustainability. And even though COVID is a great example of that, I'm really tired of talking about COVID, so I did not want to do that. So instead, I decided to focus on something that I thought was a lot more fun and actually goes along with our field of anesthesiology. Most of you are familiar with this painting of ether dome and William Morton providing the first ether in a public demonstration for surgery. And the more I learned about this, the more fascinated I became with this story. So that's part of what I wanted to share with you a little bit today. So ether was discovered in 1540. Early 1800s, there was speculation of its use for surgery, but then nothing really happened. And for the most part, it was just being used by people who were attempting to get intoxicated until October 16th, 1846, with that first public demonstrations. And this is where things get really cool. Within about 2 months of that, it was now being used in a different continent in London. And within 3 months after that, it was now being used in India. Now, to really understand the gravity of this, we need to kind of put ourselves in the world of 1840s. And, the question is, how do they communicate and how do they transport? And, any of you who may be trivia buffs may know this, but planes did not exist. The first plane of the Wright brothers took flight in 1903. Commercial flight wouldn't even happen until about 20 years after that. And when you go, well, maybe they had cars they could kind of drive around with, and that's also not the case. The first automobile was invented in 1886. So you go, okay, well, maybe it was not easy to get around. Maybe they could communicate with somebody else in London and say, hey, this is what we got to do. And the reality is the first commercial phone also did not exist until 1876. And if you want to get even more basic than that and use a telegraph, this is the more fascinating part of it, even for me, is the first commercial telegraph actually was established a month after that ether dome experiment connecting Washington to New York. So in that era, he was able to somehow make this thing go viral, which is incredibly impressive. And if you were a student in my entrepreneurship class in undergrad, I had a professor that would categorize every business idea or concept as either a painkiller or multivitamin. The concept was painkillers are the business ideas that truly address a really much needed need, as opposed to sort of a supplement category of multivitamins. And it's not to say the multivitamin approach won't be successful, but the painkiller approach, it makes it a lot easier to get customers, to grow and expand, and probably most importantly for an entrepreneur, get funding. And here you have a product that easily, quite literally falls into that painkiller category. But I think it's too easy to look at things that way. So then I wanted to see if there's another example of something that at least I would categorize under the painkiller category that would have changed medicine or could change medicine, but really did not take off the way ether did. And what was really interesting was in the same year, we had Dr. Semmelweis be the first person that identified the importance of hand hygiene in preventing spread of disease and preventing patient harm and patient death. To me, this has a much bigger impact on healthcare than ether. Even as an anesthesiologist, I think it's safe to admit that. Yet his experience was very different. At that time, personally, he was persecuted and ultimately died alone, which is pretty depressing. And even when you fast forward, more than 170 years later, and this is just a chart from a few years ago from my hospital, you got committees and individuals who report on this monthly with thousands and thousands of observations. So think about the amount of resources we're having to put something that really should be very straightforward and easy to understand. And I think our hand hygiene police today, even if when they tap you on the shoulder, they're probably more than likely going to get an eye roll from you as opposed to, oh, thank you. So how do we tell the sustainability story, and how do we approach things in a way that resembles more the Morton approach as opposed to the Semmelweis approach? And so that's really what I wanted to take a look at, and, trying to understand what the differences are. And I think so much of that has to do with how we tell stories. Storytelling to me is incredibly important in how we get things accomplished. At the end of the day, we're humans that need to connect. Stories help motivate us, help create curiosity, and have us take action on what we need to do. And part of the problem with sustainability is that storytelling component really has not been what we want it to be. When I look at most of the things I see, it's either this doom and gloom picture of this lonely, skinny polar bear that, at best, what it would do is probably make you feel sad, or, in some individuals even create anxiety. But that's really it. That's never going to really motivate the mass to do things differently. And then you got these other stories with numbers and statistics that just really don't make sense and are hard to relate to. And then finally, you got the group that says, we've always figured out a way to solve problems because we're smart and intelligent and technology will save the day. None of these really are going to do what I wanted to do in terms of pushing the agenda forward in terms of becoming sustainable. So not that long ago, I was listening to a podcast where the speaker said this line. So I'm going to use this as an example. She said, in the last 30 years, mountain glaciers have lost 6 trillion metric tons of ice. And at that time, I thought, oh, this is really important. And I wrote it down, and later on wanted to use it for a presentation. And I kept looking at it and really could not understand what this meant. And I think this goes to the heart of the problem with the storytelling. So we're going to use this as an exercise. I would have loved it if this lecture was in person and not virtual, because then we could have had some fun with it, but we're going to go through it, by examples. So one of the problems with the storytelling of sustainability is understanding time. Using my car as an example, I had my catalytic converter be stolen while I was working at the hospital one day. And it was very easy to see the moment I got into the car that something was different. It was fine when I drove it in. It's not fine now. I understand that time period. But if you were to tell me that for all these years that I've had my car, I got to do these repeat oil changes, and yeah, over time there's going to be wear and tear, yeah, and at some point the car is going to die, it's really hard for me to grasp that idea. So what people have done really are these photos that you all have seen many times, of these before and after photos. And if you live in that environment, or if you care in that environment, maybe it impacts you. But again, it doesn't do what we want it to do, which is motivate people to take action. The other problem with these types of statements is the scale of the number, right? So 6 trillion metric tons. And what does that really mean? And because we all now think artificial intelligence is going to take over and it does things way better than us, naturally, I decided to ask ChatGPT of how do you explain 1 trillion metric tons to anesthesiologists in a way that's relatable. And it started off pretty good, because it said that, you need to use comparisons and analogies related to our field. So then it decided to give me an approach that kind of took a bizarre turn. So it assumed, we care about human brain, and somehow did some funny math with the number of patients that we would be putting to sleep to achieve 1 trillion metric tons. And magically came up with a number that is even significantly higher than the 1 trillion metric ton question or concern that I had. And I thought the last line was very hilarious, which said, that number is almost unimaginable, even in a bustling hospital setting. So since this isn't going to fix the problem, I decided to see if I can maybe, take a stab at it myself and see if I can do a better job. So what I decided to do was take the largest land animal that we all know, the African elephant, and assume the largest possible elephant size, and try to see how many of these elephants do I need to put together to get to 1 trillion metric tons, and maybe that will give me an understanding. And I'm sad to say that that experiment also failed, because the answer was 147 billion elephants. And now, what is 147 billion elephants? And I hope I'm able to convey the challenge associated with a lot of this type of work. I ended up, just for fun, going back to OpenAI and using DALL-E to ask it to draw me 1 billion elephants and put them in a box. And honestly, I think I relate to this more than anything else that I've shown so far about this. And this is where storytelling, again, can have such a big impact when we talk about numbers or concepts that are not easy to understand. And I thought, oh, apologies, I thought the approach of looking at anesthetic gases and calculating that impact in a way that an average Joe who is not even providing anesthesia can understand in terms of miles driven by an average car was just genius. And to be very honest with you, that's probably what made us move towards removing desflurane from our anesthesia machines. I don't know what the global warming potential of desflurane is. And even if you were to tell me that, I would probably forget it in a few minutes. But it's easy for me to understand what it means to be driving from LA to San Francisco in my car and what that's doing to the environment. And then the last part of the problem when it comes to some of the storytelling is, what is the individual's role, right? Who is that story being told to, and what do you want the audience to do? We live in a world that puts a lot of both praise and blame on the individual. And it's, I love watching the Olympics, and that's, the perfect story of that is right there where, you work so hard and you sacrifice everything and you won a gold medal. And it also implies that if you didn't win the gold medal, it's because you probably didn't work as hard as the person who did. And sometimes that may be true, but most times it really is not. And so when I look at, our impact or my impact on that 8 trillion metric tons of ice, if I don't recycle today, or if I don't drive an electric car, how is that gonna, what's my individual role in that? And this is for me where, the work on this presentation took a major turn, because I came across an article that's absolutely wonderful, and I highly recommend all of you to read it. It's an easy read and it's pretty short. And the title says it all, which is, I work in the environmental movement and I don't care if you recycle. And while I know it's always a no-no to put a lot of big words in a PowerPoint presentation, I decided that, because she can do such a better job than me of explaining this, of putting an excerpt in there. And, so I'll read that for you in case, you're driving or you're unable to read it. This insidious force tells us that climate change could have been fixed if we had just all ordered less takeout, used fewer plastic bags, turned off some more lights, planted a few trees, or driven an electric car. The belief that this enormous existential problem could have been fixed if all of us had just tweaked our consumptive habits is not only preposterous, it's dangerous. It turns environmentalism into an individual choice defined as sin or virtue. When you consider that global greenhouse gas emission comes from just a handful of corporations, it's victim blaming, plain and simple. I really identified with this, and I have to be honest, just reading it alone, I felt it took a major weight off my shoulders in a way that's enabled me to actually be more active in my work, because that's something that always bothers me, right? We all kind of, or at least with me, carry a lot of guilt if I'm doing something that is not sustainable. And what it tries to get at is, it's not that the individual doesn't have responsibility, but that responsibility may be different than what we have thought. So, give you an example of, we attempted or wanting to bring the reusable laryngoscope handles to our hospital. And I know Stanford has experimented with that in the past too. And probably spend about 20, 30 hours, many meetings, try to figure out how to make that happen, because California has this regulation where it identifies that handle as a high-level disinfectant, meaning it needs to be sterilized. So I do all of that, try to figure out, how do we operationalize this? How do we bring this to our people? How do we introduce it? And then more importantly, how do we make sure we don't lose it? And maybe that 20 to 30 minutes would have been better spent if I'd partnered with other colleagues and other institutions and essentially have California regulation on this item changed to make it similar to every other state in the country and even Joint Commission. So that's where that difference in perspective and approach really is. And that was eye-opening for me, given the amount of focus and energy we're putting on the various initiatives at USC. And for us in our world, clearly there's more I can put on here, but these are some of the examples of entities and institutions that really have a big say in how we do things. And we have ways of reaching out to them, whether it's through various organizations or societies that we're able to, gently nudge or put pressure on them to bring about system-wide change. And the question is, so how do you do that? And, at least in the next few slides, my attempt's going to be to try to come up with some answers for that. Obviously, this is a much more complex problem that can be solved in a few minutes. But one of the ideas that I really, really love is Kingdon's agenda setting model. Kingdon was a political scientist in the 80s that came up with a really elegant way of looking at how we bring about change. And even though it's mainly used for, politics and policy making, honestly, I use this method even when I'm meeting with my chair or the hospital C-suite. And so, the premise of this is, you have the key decision maker or entity that is constantly bombarded with a lot of information, a lot of random facts from all over the place. And if you really want them to take action, you need that window of opportunity to open. And the only way that window opens is if you have these three separate streams come together at the same time. So the first one is the problem stream. And that means that for that decision maker and key individual to actually believe there to be a problem. Sometimes we need to do work on this, and then other times we don't. So if you have a president who believes that climate change is real, you don't need to do much, but otherwise you may need to do a good amount of work to bring that awareness. Next, I'm actually going to talk about the last stream that you see on there, which is the politics. And that has to do, at least in the world of governments and policymaking, has to do with the mood of the electorate. But in general, how does the group feel about it? So even if it's a department of anesthesia, what does the rest of the group or residents, attendings, and CRNAs feel about this problem? And the last part of it is the policy, which I think is the most challenging part. And that means at that time, when you have the problem and when you have the people who want to make change, do you have an actionable, implementable policy or ask that it's easily understood by everyone or the folks involved and addresses the problem you're trying to address? And when you have all of those at the same time, that window of opportunity opens, and that's when you're able to enable change. This also plays nicely to a slightly different topic that was popularized by Malcolm Gladwell in his book, The Tipping Point, kind of a play on Rogers Everett law of diffusion of innovation, which talks about how as a society we consume technology and how it gains widespread use. From Malcolm's point of view, there is a point beyond which you don't need to put as much effort, and that's called the tipping point. So all of your work and everything that makes something popular is really spent during the early phases to get you to that tipping point, and then after that, things snowball. So if you want to look at sustainability from a very optimistic point of view, maybe we are at that sort of innovator early adopter stage, and all we have to do is kind of get ourselves to that tipping point. The challenge, I guess, I have with this is, we have been at it for a few years, and as we mentioned earlier, one of my assumptions is time is running out. And at least in healthcare, we know when a new technology comes on, it on average takes about 17 years for wide adoption. So, I don't think we have the luxury of time to wait 17 years for something to change. But to Malcolm's point, there's three key factors here. So one of the things to realize is getting to that tipping point doesn't need a lot of folks. It's few individuals, and they may not even need to be leaders that are able to push the needle. But what's really important in here is having something called the stickiness factor. And this, again, goes to that storytelling component is there a message? Is there an approach that it's easy to remember and it's easy for people to understand? And then lastly, this matches in many ways May's Kingdon's politics stream, which is the context, right? So if you want to hit the tipping point in healthcare sustainability in California, it may be very different than if you try to do it in Louisiana. So understanding that context really helps make a difference. But from my point of view, one of the limitations with that approach is, it's one thing to hit tipping point with a company or a brand or a TV show. It's very different when you talk about healthcare and the complexities of healthcare. So even when you do get to that tipping point, there's a lot of other things that you need to be able to do to make sure that that change stays. And for my money, the best writer and most influential on this individual on this topic is John Kotter with his 8 Steps of Change. And I'm just going to very briefly go through these, just in case you did not know them before. But the first one is creating a sense of urgency. And urgency, again, to me, is storytelling, but it's also important to make sure that we understand that urgency is not the same as panic. Urgency is how you try to inspire folks to act. And what you also need, aside from that sense of urgency, is having a guiding coalition of other individuals or institutions and entities that get together and help support. It's really important to have a strategic vision. Many of us gloss over all these sort of mission vision stories that we hear all the time. And this is really something different. This is letting people know how tomorrow is going to be different than today. And getting people to sort of align in their approach to the problem of sustainability and climate change. And then from there, you want to make sure that you have a good number of individuals who are involved. In my example that I go through as far as what we've done at USC, I always like to put the photos of the individual who are involved, so you'll get to see some of those folks. And the one after that is removing barriers. And this is very complicated in a hospital or healthcare setting. Sometimes these barriers are operational, but many times I've found that they're more, personality and individual driven. I don't have slides on it and decided not to go over it in the interest of time, but if you have not read Thaler and Sunstein's book called Nudge, it does a really wonderful job of talking about behavior modification and how getting individuals to act in a way that we think is most responsible. And I use a lot of those strategies whenever we're trying to start something new at USC. From there, we will want to first go after sort of the easier win initiatives and projects and start to build momentum and accelerate on those. And you want to celebrate those wins and congratulate and get people excited and motivated. But ultimately, what you really need is to make sure that that change has been anchored into the culture of that organization. And for me, I guess the way I look at this and see whether we've been successful or not is, if we hire a new faculty to our department within a short time period, what do they think of our culture and how we do things? And have they realized that, we care about sustainability and we want to reduce waste, or have they not? So, that's, there's policies, procedures, and guidelines as a part of it, but I think it's a lot more wider than that. So if I'm looking at the work that we've done so far at USC, I think we have a pretty good coalition and individuals, from the president of university down that are helping support the initiatives. I think we have a good amount of volunteers, although you can always have more. And we have been able to demonstrate and celebrate a good number of short wins, and some of those I'll go over for you in a moment. And, maybe we have a bit of a vision, although more work needs to be done. And, maybe we are starting to get to the point of taking on more complicated projects. But as you can see, there's clearly a lot more work that needs to be done. So with that, I'm going to transition to the final part of the talk, which is going over USC's journey to sustainability. Most of my focus is on Keck Hospital, although some of these initiatives have taken place in other sister hospitals as well. And Keck is an interesting hospital in that, we don't have ED, we don't have PEDS, we don't have OB. I also like to say we don't have any ASA 1s or ASA 2s, and sometimes even ASA 3s. We have the highest case mix index of all academic medical centers in the Vizient database. So essentially every single day is fun chaos. A lot of ICUs and ORs for a small footprint hospital. And just like many other institutions, we have our various scopes and goals, although for scope 3, the goals are still being established, and hopefully we'll have that sometime soon. What I really want to emphasize with our sustainability governance is, we were actually pretty late to the game. So most of this got started about 2 years ago when John Reuter, our chief of operations, came to USC to lead our sustainability steering committee. And then we have a few other folks who are dedicated and involved with the operations component, and the OR certainly being a key part of that. We also have this really neat research arm. The group calls itself KUSHI, Keck USC Sustainability Initiative. And it has individuals, very multidisciplinary, from various schools at USC: architecture, engineering, stats, population health, and of course, School of Medicine. And this is the group that's putting together some of the analysis, the papers, and publications. So what are the projects we've worked on? I'm only using the clinical example. So we got rid of desflurane actually before this group actually got organized and came together. We got rid of nitrous oxide, and I do want to give props to Dr. Kalra because I learned about the impact of nitrous oxide leaking about 1.5 years ago when I had a meeting with him. And we were able to, fortunately, very quickly get rid of both cylinders and central supply. So our anesthesia department is 100% nitrous oxide free. The only place we use nitrous oxide in our institution right now is in the electrophysiology lab, and where it gets used occasionally. But other than that, we no longer have nitrous. I don't typically like to have slides with brand company logos on there, but there was really no way of avoiding this one. Our anesthesia machines are GE. And we really wanted to figure out a way to reduce the anesthetic agent waste. I know both at Stanford and some of the other UCs, you've been able to use your EMR in a way that provides alerts to the providers to reduce gas flows. Unfortunately, our EMR is not your EMR, and we spent about 6 months trying to figure that out and did not really come up with an answer. So we decided to go to the GE and use their software called Entitled Control, which does a really neat job of having the provider go to the low flow mode and use the least amount of anesthetic agent that is safe to deliver to the patient. We had a very successful pilot last year in September where we dropped usage by 73%. And so the hospital leadership was willing to invest heavily into the software upgrade, and we go live with it in August 12th. Another project for us was reducing propofol waste, and I really, really wish I could say we use propofol or we use syringe pumps for propofol, and we don't. We actually don't really use much of syringe pumps anywhere in our institution. But we did some behavior modification in our areas of high usage, such as our endoscopy center or outpatient surgery center, by kind of strategically deciding where we're going to place what bottle. And through that alone, we were able to reduce the propofol waste by about 50% in our endoscopy suite and about 40% in our outpatient surgery center. And when we were looking at endoscopy, we noticed that, hey, every single one of these patients who's coming in for a colonoscopy or endoscopy is getting these disposable pulse oximeters, and why not just switch to reusable? So this was one of the easier changes that we made, and even this probably took about 3 months of figuring out. So significantly less trash generated. Speaking of trash, we were one of those institutions that for many, many, many years, even when I was a resident, only had 2 types of bins. There was either the pharmaceutical blue bin or the red biohazard bin. And that was because of a historical incident of being cited for having the wrong thing in the wrong bin. But this past year, we were able to reintroduce our clear bags to the ORs, and that's been very successful. And there's a significant cost advantage here too. So the X's on there is the multiples in terms of how much it costs for us, at least, of putting something in the clear bin versus a blue bin, which is 100 times more expensive. And then one of the big areas of opportunities for us that we still really don't do a great job, but I hope there will be change with that soon, is our reprocessing bins. And I think some of that had to do with the company that we work with that we will be changing soon. So hopefully there will be better numbers to show for that in the future. One of the other areas that we're very proud of is the work done in our pre-op clinic in reducing unnecessary workup. Now, this didn't necessarily get started as part of a sustainability initiative, but it's been a work that over the last few years especially has really taken off because we're adding that angle to it as well. And while the patient volume has continued to increase year over year, our team has been able to significantly reduce the number of unnecessary workup without impacting patient care the morning of or the day of surgery. One of our anesthesiologists was bothered by all the stuff that we had in our central line catheters kits that we opened and then we threw away and did not use because those kits weren't necessarily designed for a patient under anesthesia. So we decided to work with a company, and what we were told was, you ask a company to customize their kit and suddenly they're going to charge you more. So what we decided to do was, I was around that time, I was going to give a sustainability grand round. So I invited everyone in the company to join the grand rounds. And after they joined, they actually reached out to us and said, we want to work with you. So we'll remove the stuff that you don't need. And we were actually able to get a discount per kit than we were before. So that's been really wonderful. I actually used one of these kits for the first time. They just came into circulation in our health system over the weekend for a case. So that was really good to see. From there, Dr. Laney wanted to work on bringing in our reusable laryngoscope handle. So that's a project that I told you a little bit earlier about. I am really, really nervous about losing these the moment we go live with it. So we'll see where that goes. One of the USC researchers was troubled by all the nitrile gloves that we use and throw away. And, USC has a good amount of research labs, and many of these research labs, they're not touching human tissue. So these can right now just go into regular trash. So she worked with a company that was local in LA that would recycle them and turn them into, playground items. And that pilot was successful. So they're hoping to expand that. We also had a successful pilot with isolation gowns in our ICUs. And because of that success, currently there's contract talks with how we can switch to reusable, disposable, or reusable isolation gowns for all of our ICUs. There is a video here, which I will not click on in the interest of time, but it's our nurses doing a video and proud of the work that they've done with our sustainability initiative.
The Keck nurses.
And I believe this is the last item I have for you, which is work done by one of our respiratory therapists who identified the problem of, anytime they go to the ICUs to intubate a patient, there's a whole bunch of stuff that goes in there, and now it's in that room with the patient, and infection prevention makes us throw everything away, whether they've been opened or not. So a very easy to do project of, why don't we just take everything that we need exactly to the room and leave everything right outside. So if we don't need it, we can not waste them. And, that was also very nice to see. And we implemented that in March, and it's currently in use. So this concludes my talk. But what I was really interested, was, where do I go from here? Where do we go from here? And if I was going to give you this talk a month ago, I would list about 50 other projects that our team is currently working on and, is proud to be working on. But, after having really thought about our sustainability movement and what we really need to do and where the focus needs to be, I'm starting to change my approach and philosophy. And it's not to say that that individual work in the institution shouldn't happen. It should continue to happen. But that sort of wider force and wider push and collaboration with other organizations and other institutions to be able to bring about change is really, really key. So basically leave you with this slide of, hoping to channel in our inner Morton and do what he did for Ether with sustainability, and not to say, obviously I think what Semmelweis did was, even has more impact, but I'm talking about more the approach of making this thing go global very quickly. So with that, I will leave you with this last slide that I think reviews in many ways some of the various topics that I went over today. And this is sort of an assessment of, how Ether ended up taking over the world, which is William T.G. Morton was the first person who, with personal inspiration and conviction, effectively administered the right agent before the right audience in the right place at the right moment in history, and ensured that the news of his success spread all over the world. So I thank you very much for your time. Because I talk so much about storytelling, I put a couple of books related to nature and climate change and a podcast that I like listening to. So if you would like to read or listen to podcasts, feel free to enjoy these. And I'm always happy to respond to anything you may have, even outside of this lecture time. So feel free to reach out to me at any point.